One thing that we certainly know now and recognise is that there is a subset, and a fairly sizable subset, of advanced prostate cancers that harbour genetic mutations, particularly in the DNA repair pathways, the homologous recombination pathway specifically. Within metastatic castration-resistant prostate cancer, this is around 25 to maybe even 30% of patients, so that's high. In metastatic hormone-sensitive disease, it's probably closer to 10 to 15%, but nevertheless, this is a substantial proportion of patients. And so it is really important that we do broad genetic testing to pick up these genetic aberrations in men with advanced prostate cancer. And there's two major implications for those men. Firstly, for them, we know that there's now a role for PARP inhibition, at least in more advanced disease, and PARP inhibition may move earlier into the therapeutic spectrum, depending on the results of ongoing trials. But it's important to know for those men, because it may inform their treatment choices. But of course, it's also equally important for those men and their families. Once we've picked up a germline mutation or alteration in one of these genes, that has implications for these men. And often men will come to the clinic and say, well, I have a son. I want to know if he could get prostate cancer. But then you take their family history, and they have a daughter as well. And of course, these particular genetic mutations are just as relevant to women in terms of breast and ovarian cancer, and there are other cancers as well. So really, it's critical that we do more genetic testing in men with advanced prostate cancer, not just because it informs choices of treatment for those men, and that's a critical thing, but also because of the implications for their families as well.